Hello, everyone. I'm Dr. Nicole Edwards, board certified family medicine physician, and I just wanted to come on for a few moments and talk to you about seasonal allergies. Why are your eyes itching, your nose running, you wake up in the morning with the sore throat or irritated throat, you've got nasal drainage, your voice is changing, you're clearing your throat all the time, and you're like, what's going on with these symptoms? Especially now in the time of COVID, because some of the same symptoms from allergies can be also symptoms of COVID. So you really need to know what's going on with your allergies. I just read an article recently that said that the pollen seasons are actually happening earlier than usual and they're lasting longer than usual. So even people who didn't usually deal with allergies are now dealing with them. And why is that? It's because due to global warming, we're having warmer temperatures and we're having more wet weather. And so what does that do? It germinates pollen. And there's all different types of pollen. There's weed pollen, tree pollen, grass pollen, all different types of pollen, but all the pollen counts are higher this year. They're saying up to 21% higher than in previous years. And so especially if you're in areas like the eastern part of the United States, especially in the southeastern portion, then your allergy numbers are really super duper high. We're getting the allergies earlier and they're lasting longer. So even people who didn't previously have allergies, they're now having allergy symptoms. So again, allergy symptoms can be watery, itchy eyes, nasal congestion, feeling like one side of your nose is stuffed up or stuffy, post-nasal drainage, some sore throat, especially in the mornings, that kind of goes away during the day. It could be some head pressure, okay? And when the stuff is not draining out properly or you have this runny nose constantly, if stuff drains back into your sinuses and it just sits there, then you can get some sinusitis or some sinus infections. And if you've had sinus infection type symptoms for longer than 10 days, then it might be some bacteria and then you might need to get some treatment for it. So what can you do about seasonal allergies? Number one, you can avoid going outside when the pollen counts are high. That is the times between 7 a.m. and 10 a.m. and also around dusk or when the sun is setting. That's when the pollen counts are at the highest. Watch the news too. See if you're going to have a high pollen count day or how well the air quality is that day. And if the air quality isn't going to be good, you'll want to avoid being outdoors during those high pollen times. You also want to do some anti-inflammatory or antihistamines to help block against the pollens. Antihistamines are now over the counter, things like Claritin, Zyrtec, Allegra. Of course, you want to check with your doctor before taking any of those medications because they can have side effects. You also may need to do a nasal rinse. I always recommend nasal saline or the medications such as Flonase, which are also now over the counter. If you're wanting to do some natural antihistamine and natural remedies, like I said, the nasal saline rinse, and there's also a really great upper respiratory anti-inflammatory called bromelain and quercetin. Bromelain and quercetin, you can get those from my supplement line called Abundantly Natural. I've got that in a pill called Allergy Essentials. It's got bromelain, quercetin, N-acetylcysteine, stinging nettles, all the natural things that you need to help fight allergy symptoms. It helps to block the allergens and it helps to bring down the inflammation. So if you're having the stuffy nose, the head pressure, the congestion, the sore, itchy, irritated throat, it can help with all of that, okay? And right now I am doing a special on Allergy Essentials, giving everybody 20% off by using the code word SPRING, S-P-R-I-N-G. Go to drnicoledo.com/shop. Look for Allergy Essentials. There's a big allergy support bundle as well, but you just need these allergy essentials and it will help with your allergy symptoms. All right, so avoid going out during the high pollen times. Take your anti-inflammatories, do your nasal saline rinses, and wear your masks, guys. Wearing the mask can help block the pollen and the allergens in the air. All right, again, I'm Dr. Nicole Edwards, board certified family medicine physician, and here to just give you some information about allergies and why it's seeming to be so miserable this year. Follow me on all social media platforms, Dr. Nicole D.O. And I'll talk to you guys soon. Bye-bye.